Today I'm going to touch on all about acid reflux heartburn. I've been seeing a lot of emails and texts pertaining to this topic, and I figured this would be a good time to really get more involved, and hopefully I can give you some good insight. Uh, if you just tuned into our program and you are not a subscriber, I invite you to subscribe to my channel. I have a lot of great information, self-help videos from spinal to nutrition to neurophysiology with the brain. So I'm going to touch on a little bit about gastroesophageal reflux disease. And here is something that it's a major epidemic worldwide. And I just want to just state that there are things that we can do to prevent this and help this and hopefully cure this. The problem that I have with people who have this type of condition is that they run to their doctor and right away their doctor wants to put them on some type of medication via, it may be an H2 blocker, just an over-the-counter type of medication, a Malanta or a Tums or something to that effect, or actually a proton pump inhibitor. And that is a big issue, is that if you are on these kind of medications for long periods of time, you potentially could be causing deficiency problems. Those who are on proton pump inhibitors, with you getting that lack of acid, your calcium levels are going to drop because your body requires acid to digest and assimilate that calcium to get into the bone. So if you're not getting that calcium into the bone, you're eventually going to become osteoporotic and start having other conditions. But we'll go into that a little later. So let's go into a little bit about triggers. What are the things that are triggered in these particular conditions? And I will just basically tell you that if you're eating a lot of spicy foods, fatty foods, heavy foods before you go to bed, these are things that will definitely cause reflux. So I'm going to go over some things you can do to help it, some remedies to help this particular condition, and things you can actually eat that would be helpful for you, as well as some other herbs. So just hang in there. We'll try to move through this as quick as we can. The first thing is loosening your clothes. Those people that like to wear tight clothes, if you have a lot of constriction on your belly and your stomach is right underneath the rib cage on the left side, and you're wearing those tight clothes or tight belts, and you are kind of closing in your organs, your digestive organs, that can be a big problem. So the first thing I would tell people to do, and this is very common for people who are overweight, they have a tendency to sometimes wear tighter clothes to make them look thinner, is that obviously when you lose the weight, you're going to be able to wear thinner clothes. But loosen up the belt a little bit, the bra, even for females. Believe it or not, when you have too much tightness around that chest, it can constrict your breathing. And what that does is that we find our least resistant position. That's generally with our shoulders forward. So if you are in this position a lot, it may even be from being on your smartphone or on your computer, but if you're in this position a lot, you're sitting, like I sit a lot, because if I'm working a lot, I got to sit. But if you're in this position, you're crunching in your rib cage, and that rib cage is crunching in within the abdominal area, which puts more pressure in there. And so the hiatus, where the stomach comes up through the diaphragm, can have more pressure than what it should, and the sphincter can become looser, and you can then start getting more food refluxing up into the esophagus. So that's another thing. So standing up straight, standing up tall is important. That's why I've always pushed good posture, because the lower esophageal sphincter, we call it the LES sphincter, if that sphincter is loosened in any way whatsoever, that can be causing that reflux, or that silent reflux making its way up into the esophagus. It can actually come up to the throat area, into the sinus. So that is a very important thing. Now, if you are eating late at night and you're not giving your body enough time to digest, I would recommend a good 2 to 3 hours before you lie down. But one of the most important things is elevating your upper body, trying to put your facial head area above your abdominal area, to be on an incline, because if you are lying down, that can cause a lot of reflux. Now, just because you're not feeling reflux, a lot of you, doesn't mean you're not having reflux. And let me give you another common thing. We talked about this recently, it's silent reflux. And silent reflux is that pharyngolaryngeal reflux, where you're getting the same thing as gastric reflux, but it's silent. So if you notice that you are losing your voice, like clearing your voice, having phlegm in your voice, you're noticing problems up in the sinuses, it can make its way all the way up in the throat. I had it. I went to a couple of ear, nose, and throat doctors, and they wanted to put me on these on proton pump inhibitors for like a couple months. I wouldn't do it. So what I'm telling you will help you because I've been through it and it helped me. So you're looking at someone, which is the proof of the pudding. The other thing is if you're going to sleep, preferably those people who have acid reflux, sleep on your left side. It's easier for your stomach to empty rather than sit up into the stomach and potentially cause more fermentation and other problems which can cause more reflux as well. So that's another thing. Sleeping on your left side is a lot more effective than sleeping on your right if you are apt to have this. Another remedy basically is mixing baking soda with water, and just a teaspoon of baking soda with an 8-ounce glass of water. And here is a trick, by the way, drinking it slowly. A lot of times, even like myself, I just want to just guzzle that thing. If it's my apple cider vinegar or my water, I just want to get it over with. It's always good to drink slowly for a lot of reasons, because if you're having too much air going down into your stomach, guess what? The air, whatever comes in, got to go out, right? It's either going to go out here or it's going to go out the other end. And a lot of times it's going out this way. So if we're belching, well, what are we doing? We're causing that spasm and a potentially reflux up into the esophagus. And a little reflux is not going to hurt you, but if it's continuous, it's going to give you a lot of problems. I like ginger. Those people who like ginger tea is a great digestive thing. It's not only for nausea, but for reflux. These are, I don't have them here, but they have ginger tabs out. They sell little ginger candies, a little bit of maybe 1 gram of sugar. I like to suck on it, but there are a lot of different ginger candies out there with very low sugar, and I do not recommend a lot of sugar because sugar becomes more acidic. But I do recommend ginger teas. Any way you like to put ginger in your food, stir fry your ginger, go for it. That's a great thing. I think that will really help you out. Licorice supplements. Deglycerinized licorice. And I showed, if you did not, you were not here the other night, here is deglycerinized licorice. We call it DGL, and it's what they basically do here is that they are deglycerinizing it so you do not have that excessive spike of blood sugar. I'm sorry, of blood pressure, because having too much licorice is not good for those who have high blood pressure, because that will actually raise your BP. So this will actually coat the mucosal lining of the esophagus and the actually all the way down the stomach. This is a very good thing to have, but I get this with no sugar. You can go ahead and shop around on that. And the other thing, while we're here, is slippery elm. Slippery elm is another great thing to suck on. A lot of these come in tablets, but I like to, if you look here, these are just the sugar-free original lozengers, and you just take them and you just suck on them. And I like them because I don't like the tablets. I mean the capsules. They got to go in your stomach to make its way back up here. I don't know why that they even sell those things. But when you can slowly dissolve it and it can make its way down the esophagus, I think that's a really big asset for you. A lot of people out there who are not really big apple cider vinegar lovers. Well, I can tell you, if you're getting heartburn or acid, I'm not telling everyone to do this, but I'm telling the selective few, and I would try it if you haven't yet. Lots of water and just a tablespoon of apple cider vinegar. If you want to try a teaspoon or two before you do the tablespoon, drink it slowly. Apple cider vinegar does magical things, and a lot of it for reflux, and a lot of it for acid. You're saying, well, how can you put acid with acid? It doesn't work that way. The mechanism is a little different than what you think it is, but just take that for what it's worth, and I think that would be helpful for you. If you have acid, try chewing gum. Chewing gum stimulates the salivary glands. The salivary glands brings on more saliva. The saliva actually helps dilute and clear the stomach acid from your esophagus. Just that in itself can be a big asset for many people. It's been a big asset. If you are a smoker, I would recommend to really get rid of that smoking, because that will definitely lead to a lot of heartburn. People who take over-the-counter antacids, these are your Tums, your Mylanta, and stuff like that. And a lot of people, they work fine as long as you don't get addicted to it. After that, you have your H2 blockers, which is your ranitidines and your pepsids and stuff like that. There's a few different drugs out there. And then what that does is that's just temporary blocks the H, they call them H2 blockers. It blocks the site of where acid is being secreted. And then you have the proton pump inhibitors. And the proton pump inhibitors really inhibits really the vast majority of acid. But the problem that I have with proton pump inhibitors is they become very addicting. So when we try to get off of them, we get a rebound. You get that in 1 week, you're going to have that rebound. So you have to find a way to get through that rebound, eat the right foods, and try to eat a lot of alkaline foods, a lot of greens, your spirulinas, your green veggies. You can juice. Try to stay away from a lot of acidic foods, a lot of sugars. That would be helpful. But the key thing with the proton pump inhibitors is that this inhibits the body to assimilate calcium, and therefore not only for osteoporotic problems, but calcium is a major component, a major mineral when it comes down to magnesium. So what we're finding is people who are not having enough calcium in their body end up having low magnesium. Now we know that magnesium has over 300 to 400 different biochemical functions in our body, and one of it is cramping, the arrhythmia. So there are so many different mechanisms. So when you go back to basics, you start having these problems, you need to really look at where you're starting. And if you're taking lots of nutrients and lots of herbs, because herbs have the effect of what drugs have, you have to really start breaking it apart and start cutting back and start slowly adding it back in to know exactly what's not working, what is working. And if you're on any type of herbs for long periods of time, it's a good idea to always get off of it for a week or two. Give your body a break. Let your liver, your kidneys rejuvenate, regenerate, so you don't build this immunity to it. I think that's a good habit to do. So you want to get away from the spicy foods, what triggers it. You want to start putting down your food 2 to 3 hours before bedtime. Lying on an inclined position if you have to. Maintain a healthy weight is extremely important as well. Let me just see any of the little notes I have that maybe I don't want to leave out. A couple of things that are really important, and I really hope that you're learning something here today, because I learn a lot just reviewing my notes and records from years and years. But coffee and tea. Coffee is a huge business today, and everyone's drinking coffee. But if you're having acid reflux, you may want to cut back to coffee a little bit. I hate to tell you that, because coffee and tea can make your acid reflux worse. Chocolates, another things. We talked about spicy foods, greasy foods, hydrogenated foods. So if you're eating a lot of fried foods, which I really hope you're not, that's another thing. They, believe it or not, peppermint has been known to be good in certain types of acid reflux, but in a lot they have not. Peppermint has actually been found in a lot of clinical studies good for IBS, irritable bowel syndrome. So if you have a lot of cramping, it's good, but they're saying mint in general is not the best thing for acid reflux. Your tomato-based foods can actually aggravate it as well. So really, if you really want to help this, you need to really have mindful eating. You have to have the approach of your eating, how you're eating, how much you're eating. Chewing your food thoroughly is really important. Trying to cut your food into smaller bites. Try not to swallow whole big chunks of food. Making sure your body is absorbing it. I like particularly, and I can recommend that if you're going to have, foods and smoothies, grind up the whole foods. Get that fiber with it. The fiber is a prebiotic. The fiber helps assimilate. The fiber prevents cancer. The fiber helps lower triglycerides and cholesterol. Start putting in some smoothies. I think that's a really good thing to do, because of the fact that when that food is grounded up, it digests a lot easier, and it digests a lot faster, and it's just easier for your body to assimilate it. You're going to have less of a problem. Understand, as we get older, what happens? What happens is we start losing enzymes. So we start losing, hydrochloric acid and our pepsids, and our enzymes become depleted. So we don't have the enzymes. So if you're eating a lot, I highly recommend that. A lot of people love to drink with their meals, and I do too at times, but I've learned that I can't do it like I used to. Maybe when you're a lot younger, you can get by with it. Start drinking your water, or your whatever you're drinking 10, 15 minutes before and 10, 15 minutes after. If you want to sip on it, it's fine, it's okay, but that dilutes enzymes. When you dilute enzymes, you're wondering why you're getting a lot of gas and bloating, because you don't have the enzymes to digest it. So that's another very important thing. So we mentioned sleeping on your left side. It's very important. We call it left lateral decubitus position. This will actually help that what we call the nighttime heartburn. We talked about avoiding that tight-waisted clothing. If you wear anything real tight, easing stress. Now, if you're under a lot of stress, that can actually cause more adrenaline, that your fight or flight is going to pump up, and your epinephrine, your cortisol levels, and this can eventually lead to more acidity. I would recommend everyone out there to drink lots of water. And we can spend a whole nother topic and program talking about alkaline water. But I don't really feel you have to waste your money on alkaline water, because I'd rather see you waste your money on alkaline vegetables. Why? Because alkaline water goes right through your system. And alkaline vegetables stay in your system a lot longer. So if you do the math, I think the alkaline vegetables are going to be the winner. And I don't really believe so much into that alkaline water. Now, I really won't say much on that. So a couple of things, let me just briefly mention. You have your slippery elm we talked about, your apple cider vinegar, your ginger. I like aloe vera juice. I don't know if people out there love aloe vera juice, but papaya is very good. Jack, thanks for bringing that in. Papaya is excellent. But your turmeric in certain conditions, a lot of people swear by turmeric. A lot of people say no. And again, that's something that's going to be a personal level. Your deglycerinated licorice that I showed you is important. Honey. Even though honey has sugar, there are a lot of different multiple properties besides the fact it's an antiviral, antibacterial, antifungal type of thing. It's got a lot of interesting properties, honey, and honey has been very helpful in a lot of people. Even to the fact that chamomile tea has been helpful for digestion as well. And they actually say that marshmallow as well. So those are the main highlights that I wanted to bring out with all of you today. And I really hope that you enjoyed it. I just wanted to throw it out. It's actually late at this time, but sometimes I just get in this mode where I just want to go ahead and share and love and just kind of put it together with everyone. I want to say a lot of thanks to the many people out there in the chat room tuning in with me here today. And I just want to say, stay strong, be persistent, and those that are looking to lose weight, just stay on track. There's a lot of great videos, a lot of great remedies I have on my channel. Check it out. If you have not subscribed, I please ask you to do so. I think you really enjoy a lot of the content that I put out, and I really do it from my heart. Anyways, I want to say good night, good day to everyone out there. Blessings to you and your family. We'll catch up with you real soon. Bye-bye now.